This year's flu season got off to an early start and isn't expected to peak until next month. The CDC here is not calling it an epidemic just yet, but it's already shaping up to be the worst flu season since 2015.
This morning, a deadly strain of the flu is sweeping the country. Hospitals seeing a surge of sick patients.
Today was terrible, the coughing.
It was getting worse.
Very bad.
Right.
The CDC says 46 states are now reporting widespread flu, and more than 41,000 flu cases have been reported, nearly 3 times more than this time last season. California has been hit especially hard, at least 27 deaths there of people under 65 since the flu season began in October. This hospital near San Diego opening a triage tent to care for the flood of patients. Emergency services stretched thin from Omaha.
About 1,200 positive flu tests, about 400 of which came last week.
To Dallas.
We are now seeing 12 to 15 cases per day of people calling 911 with flu-related symptoms. That is a 611% increase.
The strain responsible for the outbreak is known as H3N2, a particularly deadly variety of influenza. Making matters worse, hospitals nationwide are facing a shortage of IV bags because a major manufacturer is in hurricane-ravaged Puerto Rico.
Anytime you see more patients, especially with flu-like symptoms where they could be dehydrated, you need more IV fluids. Because the IV fluids are limited, that means they're not able to give as many out as they'd like.
At Maimonides Medical Center in Brooklyn, they're feeling the strain, but managing so far.
So there has been a shortage of these kind of medications, of IV fluid bags. However, this has not adversely affected patient care.
Doctors say the best preventative medicine is still getting a flu shot.
And did you get the flu shot? Had you received the flu shot
No,
this
I
year?
think we should have really gotten one.
Initial reports citing data from Australia had initially suggested that this year's flu vaccine was only about 10% effective, but doctors here in the U.S. actually think the effectiveness is much higher, probably about 30%. But still, they say you should get that flu shot. Savannah and Hoda, even if you do get the vaccine and get the flu afterwards, they say the symptoms at least could be less severe. Back to you.
All right, Gabe, thank you.